It's Doc Swiner. Happy Monday. Hope you're doing well today. Give you a couple of moments to come in. Maybe you're on your lunch break. Maybe you took the day off, which would be wonderful. And have a little time. Maybe you're watching the replay and wanted to catch some tips and tricks about chronic headaches. So welcome back. Welcome back. This is Medical Minutes. For those that are joining me for the first time, I am Dr. Nicole Swiner, board certified family physician, mental health and self-care expert. I do this series kind of maybe on a quarterly basis. I'll do a couple of weeks in a row where I talk about the bread and butter of family medicine, of mental health, the topics that I like to talk about and hear about the most, and share them here on Instagram, and then save the recording so you can watch it later either on my YouTube channel or here on my Instagram Reels. So here we are. And I hope you guys are doing well. Shout out, let's see, what's been happening in the current news. Oh, shout out to Duke University, my alma mater, for their 100th year centennial anniversary and homecoming this past weekend. Got a chance to see some of my friends and sorority sisters and all that, and so that was fun. Unfortunately, of course, unless you've had your head in the sand, you know about Hurricane Helene and the horrific events and complications that have happened since then, particularly in the western part of our state near Asheville and Tennessee. God bless those folks who are still dealing with those devastating effects. And on my Instagram story, I actually have a link to United Way and some of the donation efforts that are being held and collected for those folks. So please don't hesitate to do that. And there's just a lot of stuff going on. But I hope you guys are taking good care of yourselves, finding some time for rest and relaxation, taking a pause from social media from time to time when you need it, from politics, from world events, and taking good care of yourself. So we're going to talk about all those things that can lead to chronic headaches and tension and stress and all that bad stuff. Hi, Erica. Happy belated birthday. So we're going to get into it. All right. So headaches in general, you would think are pretty commonplace, right? They happen frequently. You have a headache here and there, no big deal. I had a neurologist bring something to light. A neurologist told me that headaches are very common, but they are not normal. We have, normalized headaches. Oh, I have a bad headache, or well, stressed out, I got a headache, or I'm tired, I have a headache today. Things that are, causing me too much worry and overwhelm or giving me headaches, which again happen frequently and regularly, and we hear them all the time, but headaches in general are not normal. That's what a neurologist told me. So that's an interesting way to kind of think about it, to kind of restructure the way that you think about the causes of headaches, why you have a headache either from time to time or frequently, and what you can hopefully do to treat it and get rid of them, or at least decrease the regularity and frequency with which, or the intensity with which you have them. So let's talk about headaches. So everybody that has a headache doesn't have the same kind of headache. There are many different types and causes and triggers for different types of headaches. The way that I kind of categorize them include tension, and tension can come in all forms, whether it's tension on the blood vessels, tension on the muscles of the head or the neck or the shoulders that then contribute to headaches, tension. Cluster, I don't know if you've heard of cluster headaches, so we'll talk a little bit about that. Migraine headaches, which are probably the ones that you hear about the most, and then the bad stuff, right? So the first three are probably the more commonly heard of. Migraines probably is the most commonly complained about type of headache, or people think they have migraines when they're actually something different. But the first three are kind of the more common, less worrisome. The last category, bad stuff, is the stuff you need to worry about. So we'll talk about that. We'll kind of break it down. Let's start with tension. Tension is probably the least worrisome type of headache, meaning generally not fatal, not related to something medical or metabolic. And the thing that is probably the most common cause of a headache. Tension, as you can imagine, happens to deal with the tightening and the tension, literally, in the muscles that contribute to the neck. And if you look at a graphic or a drawing of the skull of the body, and the muscles that connect the shoulder girdle and all of that. It's almost like it's one big muscle from the frontal part of your head to the parietal to the occipital part, which is the back, and extending down to your neck and your traps, your trapezius muscles and your shoulders and shoulder blades. It's almost like one continuous sheet of muscle. And then don't forget these small muscles here, like your scalenes. Look at that girl remembering her anatomy. Scalenes down to the clavicle area. I mean, it's almost one big sheet, right? And so you can imagine if you're tight in one place, it's going to communicate with another place to tighten, tighten, tighten. Or if it started with your neck, if you slept wrong, you got what we call a crick in the South. You got a crick in your neck. You can imagine that ball of tension then talks to the next, collection of muscles, and they all talk to each other and communicate and can cause a headache. Tension, okay? Long story short, try to relax the parts of the body that tend to bother you. So if you know that, or you feel like you chronically have neck issues, whether it's arthritis or it's a muscle spasm because of the way that you're holding yourself or sleeping at night or looking down at the phone continuously, or your computer screen isn't at the right height, then you can imagine, hey, the therapist, hey, Alexis, one of my most favorite hairstylists and trichologists, if you're working on that head of hair and their seat is not adjusted high enough where you don't have to look and position yourself down. If you feel like those things are happening from other areas in the body, you have to address those other areas of the body, almost like anything else in medicine. Hey, you have to address the root so that you can get rid of the result, right? Fix the root so you can fix the result. It's not just about slapping on some Tylenol and ibuprofen every day and having a headache and you feel like you've gotten rid of it. It's about figuring out what the triggers are. So ergonomics, meaning, the positioning, making sure that your body is in the right alignment, is a big deal when it comes to fixing what causes the tension. So addressing what's happening in the neck, addressing what's happening in the shoulders. I have definite spots in the back near my shoulder and shoulder blade, my rotator cuff, that I can push on as a trigger point and it hurts. And if I don't address it over time, not only will it cause shoulder pain, but it then extends to the head. So I get things like frequent, I'm a huge advocate of massage. So frequent massage. I have a neck pillow that you can put into the microwave and warm up. We have, heating pads, we have massage oils, we have all those things that can help to reduce the stress in one area so it doesn't radiate to another. What else? Tension is also related to hydration. Again, I'm a big advocate of hydration, particularly oral hydration, and then IV if needed. But drinking lots of water helps to keep your muscles relaxed. It releases the lactic acid that builds up in those muscles so that they don't get tight and tense and overworked and dry. So making sure you're drinking lots of fluids is helpful. I have to remind myself about my posture, sitting up straight with your shoulders back, releasing and unclenching your jaw muscles from time to time. Helps to relieve that muscle tension that can then radiate to your head. Speaking of muscles and jaw, TMJ, that temporal mandibular junction that we have here that connects our jaw, that can get really tight because of muscles. And so the dentist can tell you, they can actually, if they're feeling, what they should be doing also is feeling around your face, feeling around your jaw, your mandible. They will get inside your mouth and feel around near your tongue muscles to make sure you don't have any lumps, bumps, and all that. But also to see if you have any tension, if you're having any grinding of your teeth. And if you're grinding your teeth a lot, or your jaw, you're having lockjaw type symptoms, then that can cause a lot of muscle pain and tension that then radiates upward. So making sure you're paying attention to all the things that are in alignment or supposed to be in alignment is one way to get rid of tension. What goes without saying, the more sleep, the more rest in general, the less stress, the better tension in general will be. Okay, so that's probably the most common. People don't always recognize that it's tension related. They think maybe it's more along the lines of migraines, which we'll talk about in a minute. But tension is probably the most common cause or most common category of headache. Cluster, the second category, probably not as common, but probably more debilitating in terms of the type of pain it comes with. If you think about tension, of course, muscles are sore, they're tight, crampy, spasmy, usually across the band or feels like a band around the front of your head or around your head. That's tension. Cluster is usually one side. It can also affect the eye, and it can cause tearing. So on a medical exam, that's usually the dead giveaway. Unilateral, meaning one side, and then related to your tear. Hi, how are you? Related to tearing or redness of the eye. Having to do more with your blood vessels, with constriction. Sharp. It's a sharp feeling headache. And it can be pretty debilitating. Like, people end up going to the emergency room a lot and having to take a lot of meds and all that to figure out what's going on. Most common thing that they do, especially if you go to the emergency room or see a neurologist for these types of headaches acutely, is they do oxygen therapy by literally breathing in the oxygen. That can help relieve some of that inflammation and constriction that happens with the blood vessels. So that's one way they treat it. And I guess theoretically, if you have them on a more frequent basis, they can prescribe at home oxygen therapy as well. I even know some med spas that have oxygen therapy available for different reasons, and that could potentially decrease those types of headaches. I've thought about adding that on to my wellness practice, but I'm a little nervous because too much oxygen is also not a good thing, right? Just like too much carbon dioxide is also not a good thing. So I'm a little leery about that, but if it's within a clinical setting and you have an MD or a DEO that's managing that for you, then, hopefully they know what they're doing and they can back you up, right? Cluster headaches. The other things, I'm looking at my notes, I want to make sure I'm not missing anything. The other types of things that we treat cluster headaches with, of course, include medication. If you've done all that you're supposed to do with decreasing your stress and getting on your rest and making sure you're getting good oxygen and all of that for your triggers, then, of course, medications are available as well. We'll talk about some of those. Third category, probably the biggest one that you think about and hear about the most, are migraines. Very debilitating. Generally start in your teen years, generally genetic, meaning if your family history has a lot of folks that suffer from migraine headaches, then there is unfortunately a risk that you can suffer from them. Blood vessel related, vasoconstriction can sometimes be associated with the type of tension type, things that we talk about. Like cluster headaches, they are also one-sided, usually one-sided, very painful, nausea, vomiting, floaters, seeing auras, changes of your vision. The aura is kind of the thing that happens right before the headache is hitting. You kind of have that signal that it's coming, so hopefully you can take your what we call abortive medicines that get rid of it before it happens, before it really kicks in. But once those headaches really kick in, these unfortunate patients can suffer for days at times. They usually to be in a quiet, dark room because light and sound sensitivity can definitely be an issue as well and make those headaches worse. Takes a little bit more than ibuprofen and Tylenol usually to treat these. Usually you have to be dark and quiet. Like I said, they will treat the signs and symptoms of their nausea with nausea medications or anti-nausea medications. And then there are different levels of pain medicines and a very specific type or class called triptans, the Omnitrexes and the Relpaxes and all of that specifically treat migraines and won't treat any other type of headache. So sometimes if there's a question as to what kind of headache somebody's having, sometimes we'll prescribe the triptan kind of as a test to say, okay, well, if you feel the headache coming on, you take the triptan, it gets better, then that helps us to diagnose it as a migraine. If it's not better, then we know we have to go look for other reasons, other sources. So migraines, very familiar with those. Last category, as I mentioned, is the bad stuff, the stuff that you need to run to the emergency room with. Hard to tell sometimes, if you have a horrible migraine headache and your pain is 10 out of 10, and you've tried all the medicines at home, nothing's working, and you still have pain, it becomes a little bit more complicated to differentiate between this is just a really bad migraine or this is something really bad. And when I say those things that are really bad, I mean the stuff that you look up on Google, right? And the stuff that scares you on WebMD, the tumors, the strokes, the hemorrhages, the meningitis, things of that nature. Much more rare that a headache is going to be related to just tension or just migraine than it will be an aneurysm. But the types of things that happen with the ones that you have to worry about include I took all my regular meds and nothing is working, right? Having visual changes or neurologic signs or symptoms that are happening with the headache, although that may happen with migraines too, but the types of things I'm talking about are the cardinal signs of a stroke that you know of, right? Droopiness of the face, slurring of speech, confusion, right? Your thoughts aren't coming to you. The lack of movement or feeling of your limbs, arms and legs, the inability to walk and talk, right? Those are the bad signs. Those are the signs that you need to call your doctor, call 911, go to the emergency room, right? Or you've never had headaches in general, and then you wake up with the worst headache of your life. Or you've had tension-related headaches off and on, whether it's right before your period or you didn't sleep well the night before, and then you wake up with the worst headache of your life. That literally is a sign to us that something bad could be going on, and we may need to do some imaging, some CT scanning, some MRIing of your head. That worst headache of your life to us is a trigger, and that's another kind of thing that likes to pop up on medical exams. That's usually related to something intracranial, right? Is it a bleed? Is it an aneurysm? Things of that nature. Again, much less common. Don't want to freak you out to think that every headache is related to that. But if you've had really bad headaches, or your headaches have gotten worse and worse over time, more intense, last longer, can't get rid of them with your usual abortive therapies, or you don't really usually have headaches, but you wake up with the worst headache of your life, that's something you need to pick up the phone and call the doctor about. That's something you may need to go to the emergency room to see a professional about. So that's can be a pretty big deal. Concussions, right? That's another thing that can be related to really bad things that can cause headaches. Severely high blood pressure can cause really bad headaches, and it needs to be addressed, because then you don't want it to lead into something intracranial happening. So again, another plug, as usual, as your family doc, right? You should always be checking in with your primary care, especially as an adult, especially as adults of color. You need to be checking your blood pressure regularly, at least once a year at your annual exam. And if you know that you are prone to having blood pressure issues, you even need to get your own cuff at home so that you can monitor those things. Okay. All right. So those are the big four. All right. Hi, DJ Big Fella. Those are the big four types of headaches. We talked about the bad stuff. Don't want to freak you out, but let's get back to like the more normal things. Let's talk about what else? Where should we go from there? Let's talk about more of the causes of those types of headaches. And sometimes you can have a mix of those types of headaches. We talked about hypertension just now. Sleep apnea. Interestingly, particularly if you're waking up every morning with a really bad headache, make sure that you're not snoring or having really significant sleep apnea and not delivering enough oxygen to your brain and then waking up with headaches. That can be a sign that sleep apnea needs to be treated. Same with your sugar. Sugar may be elevated, blood pressure can be elevated, but usually if you're waking up first thing in the morning with a headache, usually it's related to things like sleep apnea or snoring and not getting enough oxygen to your brain. I mentioned menstrual issues a couple of minutes back. Premenstrual headaches can be very common, or even during your period. Your premenstrual headaches definitely can be a sign that things are happening, or that time is coming. So you want to make sure that you're pre-treating. If they're really bad, they're really debilitating, if they, are horrible and keep you home from work and school during the period, there are ways that you can get ahead of it. You can take vitamins. Again, we'll talk about treatment in a moment, but there are particular vitamins that you can take. Especially if you are on your schedule and you know when your period is coming, you can say, okay, well, 2 or 3 days before that, I know I'm going to, have these types of symptoms, including really bad headaches. Let me go ahead and get on my vitamins now. Or let me increase my hydration now so that, I can try to stay ahead of that, or at least decrease the intensity. What else? Change in atmospheric pressure. With the big storm that just happened, or with the seasons changing, people will often complain about headaches because they literally can feel the barometric pressure changing. Usually related to tension. It's almost like the atmosphere is pushing down on you. Or a hurricane is happening elsewhere. Some people can actually feel that, and it causes tension headaches, so that can be an issue. Again, if you kind of know your triggers, and sometimes, as providers, we'll ask people to do a headache diary so that you can go back and see and journal when you had your headache, what was happening the day before, what was going on with the weather, did I not drink enough water, did I not sleep well enough, did I have too much coffee, did I not have enough coffee? If you can kind of identify your triggers, and that helps us to identify what kind of headache you are so that we can prevent them and treat them the right way. So sometimes it takes writing down, the last time I had a headache, I can go back and see, there was a hurricane, or it was changing from summer to fall, or, you can try to identify what those issues are. All right. So those are the big ones that I wanted to mention. Dehydration, always going to be a big issue. Let's talk about natural remedies first, and then we'll get into some of the pharmaceutical. Again, goes without saying, water, big deal, right? So we'll say it again. If you have a really bad headache, again, depending on the type that it is, but in general, if you're having a bad headache, you've done all the things you're supposed to do. If you use a cold compress, a lot of these headaches that we have, or the types of headaches, are usually related to either blood vessel dilation, meaning relaxation, or constriction, meaning tightening. Cold can not only numb up some of those nerve endings so you don't feel the pain as much, but it may also help a little bit with the actual blood vessel, the muscle within the blood vessel, so that you don't feel as much of the pressure. So a cold compress across your forehead or wherever the headache is happening can be helpful. If you know that your triggers come from your shoulder and your neck and your muscles are tight, then using heat on those areas can be helpful so that you relax the muscle and hopefully it won't radiate and talk to the other muscles and cause tension. What else? Oh, vitamins and supplements. My favorite ones to talk to people always about, almost when it comes to any type of cramping or muscle related issue, is magnesium and riboflavin, which is B2, vitamin B2. There are lots of different magnesiums out there, so you want to be careful about which one you choose, because if you choose one, you might be treating something different, right? So, for instance, mag citrate, we will sometimes prescribe for constipation. That will not help your headache. Mag oxide is the type that you want to find. And if you go on Amazon, and you search specifically magnesium for headache or magnesium for constipation, it should give you the right. And that's not a promotion for Amazon because they have not paid me. But if you Google it or look up WebMD, etc., you want to look up the type of magnesium that you need. Magnesium glycinate, for instance, is for sleep. So there are different types. Mag oxide, OXIDE, is the one that is most commonly for headache. So you want to incorporate that into your either your daily or your PRN, your as needed routine, depending on how frequent your headaches are. Riboflavin, vitamin B2, that was one of my most favorite prescriptions to write for people because they really did not need a prescription. They could get it over the counter, but you could prescribe it in a higher dose if they got it from the pharmacy. I think it was like 400 milligrams per day to prevent really bad tension headaches if they were sufferers of that. I like to give that to the younger folks, because you don't necessarily want to start them on medicines too early if you don't have to. Those are the big two. Other things that I found that people say are helpful in studies include garlic. What else? Ashwagandha is another one that's good for, particularly if your headaches come from stress, mental health, anxiety. Ashwagandha is a good relaxant. Vitamin D, interestingly. Vitamin D we usually will credit as the culprit for low mood, fatigue, sometimes pain-related things, but apparently for headaches, if your vitamin D is deficient, then increasing your vitamin D is also very helpful. Okay, so those are some of the natural supplements. Excuse me, we talked about water, we talked about rest and de-stressing, massage, big to do, acupressure and learning how to do your own relaxation of your pressure points, your temple, sometimes the web between your thumb and your first finger is good, not only for nausea, not only for like dizziness and imbalance, but can help with pain and headaches. You go and get your massage therapy or your acupuncture, they can actually push those pressure points and show you where they are so that you can, do those things at home to help prevent the headaches from getting really bad. Goes without saying. Okay. What else? We'll get to medications in a moment, but I'm going to make sure I'm not missing anything. Did you all have any questions? I'll pause for a second. Any particular questions about your own headaches? Anything like that? Let's see. I want to make sure I'm not missing any of those big, like, atypical points. All right, medications, last part. So let's say for tension headaches, you've tried, of course, stress reduction, aromatherapy, massage therapy, you're drinking all the water, you're sleeping 6 to 8 hours a night, you're doing all those things, you're meditating, and you still have tension headaches 2 to 3 times a week where you're having to pop pills for. If we're talking about popping pills, then we're talking usually about over-the-counter stuff like, if you're in the South, BC powders, right? Those types of things that have aspirin, caffeine, Tylenol in them, and then your ibuprofens, your naproxens, your Aleve, and all that. Usually you're popping those. Yes, those are helpful. No, we do not want you to use those every day because they all have bad side effects if you're using them too frequently, or if you're taking too many. The other thing that can happen is what is called rebound. So if using those things too frequently, can actually cause worsening of your headache. Or if you're using them frequently and then you stop taking them, the headache can come back even stronger. So only use, and this goes for any pain medicine or any over-the-counter thing, only use them intermittently, only when necessary. Do not use those things often and without instruction, because they all have, no matter how gentle you think Tylenol is, there is particular or possible complications if you take them too regularly, too frequently. But let's say you've done all that, right? You've done the natural supplements, you've done the natural remedies, and you're still having problems. If you go to the doctor, and again, if you've been paying attention and you have your headache diary and journal and know that, okay, I know my headaches get really bad right before my period, or when the seasons are changing, I know they're really bad, then there are certain prescriptions that we have specifically for headaches, and then we have medicines that we use for other things that have either been FDA approved, or we use them in off-label situations because we found that they are helpful for headaches. So if we're talking specifically about migraines, we're usually talking about triptans. And triptans go by the name of like Imitrex, Relpax, those types of medicines, and they are specifically for migraines. They don't help any other type of headache usually. And those medicines are very specific neurologically, and that's how they help to abort, or they help to stop the headache once it happens. They are not preventative, right? So you have to get them, or you take them as needed. There are now some injections. I'm reminding myself, there are now some injections that are used for migraines preventatively, and you have to go to your neurologist or go to your primary care doctor for them to inject them. Emgality, for instance. Disclaimer, I have no compensation or any ambassadorship with any of these medications, so I'm not telling you to use one over the other. Also, my second disclaimer that I usually say, I forgot to say, is always talk to your primary care doctor before trying any of these things. But there are now injections that you can use preventatively to help prevent, hopefully, the intensity and the frequency of migraine headaches. So look into that if they are an issue for you. The other things that can help migraine and other types of headaches include, and if you recall, if you were here a couple of weeks ago for my hypertension talk, there are hypertensive medicines that we later found are also helpful for your chronic headaches, because again, blood vessel related. If you have tension, if you have constriction of your blood vessel muscles, by relaxing them and promoting better blood flow, your headaches can improve. So things like, let's see, off the dome, will it come back? Propranolol. My notes are on the floor. Propranolol. Some of your calcium channel blockers like valsartan. That's an ARB. Amlodipine, which is Norvasc. Procardia. It's coming back. Beta blockers, your calcium channel blockers, anything that have to do with your blood vessel tension and your blood flow also can prevent headaches. So not taken at the time of the headache, but preventatively can actually prevent headaches. What else? We talked about oxygen therapy for your cluster headaches, again, a very specific type of headache. What else can be helpful? Of course, your higher level pain medicines, when you get into the really bad tension or migraine type headaches, sometimes they'll even prescribe some old school antidepressants or pain medicines like amitriptyline or triptyline. Some of those medicines, again, they help in a very specific neurologic way to help prevent pain. Gabapentin, which is also known as Neurontin, can be prescribed for some of these headaches. Topamax, some of the anti-seizure medicines. Topamax, we found that if taken preventatively, can also help decrease the frequency of headaches, which is always such an interesting finding for me. With some of the some medicines are prescribed for one thing, and then you end up finding, oh, by the way, my headaches are better. You're like, oh, okay. Topamax, interestingly, is also used for weight loss. Again, it was used for anti-seizure effects. Later, we found out that it helped with these other things. So, moral of the story is, try to figure out what your triggers are. Write down what's happening during the time that you're experiencing these really bad headaches. Go to your provider and say, hey, this is what's been happening. I've tried Tylenol, I've tried ibuprofen, I've tried this, I've tried that. It's not working. I'm missing days out of work. I'm having to, sleep off my headache for 1 or 2 days, and I'm missing out with hanging out with my family. I've decreased my alcohol intake. I've increased my hydration. What can we do? And thankfully, there are a lot of options. All right. Look out for the warning signs that we talked about. Worst headache of my life, having neurologic signs and symptoms along with the headache, not really being a headache person, all of a sudden having new onset headaches. That's a warning sign. What else? Visual changes. So not just seeing floaters or light sensitivity, but visual change, like I can't see out of my left eye all of a sudden. Warning signs. You definitely need to go and see somebody emergently to be evaluated. Okay? All right, folks. Enjoy, watch the replay if you didn't get a chance to catch the whole thing. Leave your comments or questions in the comment section here on Instagram or on YouTube. I'm going to put this on my YouTube channel, which is youtube.com/DocSwiner. And I'll try to come back and answer those for you. If you ever want to do an actual consultation, either virtual or in person, you can schedule with me as well on my Serenity Hydration and Wellness website, or I have a calendly.com/DocSwiner/consultation link that you can also do that with, or just send me a DM and we can figure it out. All right, guys, be safe, be blessed, and I will probably add on another one since I missed last week. I'll probably add on another Monday. Next Monday, I will look at the schedule, make sure I'm open, and try to squeeze in something on COPD and asthma for you too. All right, y'all be good. Bye-bye.